Hi guys, today I have the medical expert and our senior doctor, Dr. Richa with us. Hi Dr. Richa.
Hi Amanda, how are you?
I'm doing very good. Wishing you and all the doctors a very happy Doctor's Day.
Thank you so much.
What we would have done without you guys, I cannot even imagine. So Dr. Richa, I've been very curious and I really want to know what is this whole Hippocratic Oath all about?
Actually, this Hippocratic Oath is an oath which we doctors take on our graduation day before we start our practice. And this is a pledge which we take to treat the patients to the best of our judgment and ability. And also we pledge that we will not cause any harm to the patients or their family members in any way. So this is the crux of this oath, and so actually it just defines the code of conduct for the doctor.
That's really very noble. I think that is why you guys appreciate it so much. So now that it's been 2 years of pandemic and you being a family doctor yourself, outside and for all our Indus family members, how has it been so far for you?
I think the pandemic has taken a toll on the doctors, and I think this is not a very known fact, but it has drained the doctors also mentally and physically. But then we have to keep calm. We have to keep updated with the latest guidelines. And I think even after 2 years of the pandemic, what I can say is that, COVID is not yet over. We still cannot keep our guards. We can't let our guards down. So I think we have to follow COVID appropriate behavior now. And very important as a doctor, I would like to emphasize that if you have any symptoms, even the mildest of the symptoms, please isolate yourself for your own self and for your family members. And you can be connected online. And for us doctors, in the second wave, of course, it was a very difficult time. The patients were very critical that time, but somehow the doctors have managed to tide over that part, and now we are in a much better position to handle the COVID pandemic.
Right. No, I'm sure mentally and physically it has taken a toll on all of you.
Yes.
And we cannot thank you enough for all the efforts that you have taken in order to ensure that the families and individuals are healthy and back to normal.
Yeah.
Although it's been 2 years of COVID, but there have been other disorders and other ailments that people have suffered through as well. So do you want to sort of throw light on that as well?
Yeah. So what I would like to tell everybody is that do not neglect any symptom, any change in your body. If you feel that there's any change, please do not neglect it. Consult a doctor immediately and be compliant. Follow the guidelines or follow the prescription which has been given to you. What we have noticed is that we give a course of antibiotic, but when people start feeling better, they just stop it on their own. And there are certain conditions wherein long-standing medications are given, like for diabetes or thyroid. And for thyroid especially, we have seen the moment they start feeling better, they feel that this is the time I have to stop the medicines. But please do not stop any medicine without your doctor's advice. The other thing I would like to say is that be vigilant about your health. Go for regular health checkups. That's really important. Health screenings, knowing the condition of your health at a juncture of time. That's very important. Then, of course, make healthy choices. Try to avoid addictions. This is especially for youngsters. Even for thrill or anything, I would say that there's no health benefit of smoking or drinking. So try to avoid addictions. And definitely include a physical fitness regimen in your daily routine.
Right. So was there anything funny that has recently happened with you?
Yes, I think people do Google their symptoms a lot and then they come up with their own ideas. Like I wanted to say that there was this WhatsApp message which was circulating that after the COVID vaccine, it's just 2 years and then people are going to all die after 2 years after the vaccine. And then people come up with a simple headache thinking that it's something like brain tumor. They tend to overreact. And then they self-medicate themselves. They prescribe to each other.
Yeah, so that's actually very frequent. Yeah.
So there was this patient who had come to me with lot of sweating and palpitations. Her heart rate was very high. So what had happened was that she had a mild discomfort in her throat, and just because her friend was taking a medicine, the friend prescribed this medicine to her, but unfortunately it had this reaction in this particular person. So here I would like to emphasize that medicine is a science. Please do not take it casually.
Yes, point to be noted. Yes, I agree. The other bit I wanted to ask you was that any innovation that you think is is going to be path breaking that has happened very recently, and you as a doctor believe that this innovation is going to help doctors and patients.
See, I think first thing which I feel is very important is the telemedicine which has come up. I think it's going to be a major way in future. It's going to be here now, although it's just started recently, but that is very important. There are a lot of now screening tests which are available through blood. We can even screen cancers through that. And genetic testing, which is a predictive testing, that is also very important. And I feel that it is also one of the things of the future.
Right.
So that basically enables us doctors to predict things, plan a risk-free and a more efficient treatment. And even now we have this pharmacogenomics, where we can actually predict, or we can actually be so precise that it's something like a personalized medicine. So what medicine suits you might not be suiting me.
Correct. The example you quoted earlier.
Exactly.
Right.
So we know that, for a particular patient, if we have this report, we know what medicine would suit this person, at what dose would it suit this person. So that becomes very exciting for us doctors.
Right.
Especially for those cases where things might change fast.
Right.
So for those cases, I think these kind of testing, the pharmacogenomic testing and all those innovations are path-breaking. Really good.
I think anything that helps you take down the trial and error times and give better treatment outcomes is definitely going to be path-breaking.
Yes.
Thank you so much, Dr. Richa, for spending time with us, especially on a day like today. We're going to be responsible citizens and follow all directives from our doctors and try to be healthy, fit and wise. I think it's time for all of us to samajhkar jiyo behtar.